Beginning, and I'm a fervent advocate of a pan-European accelerated birth cohort study. It was something I recommended to the European Commission whilst I was at the OECD after reviewing the availability of child well-being data in OECD countries, but it was a European Commission project. I'm sure some of you will have heard what I'm about to say, but since I last spoke to this group, I've done a bit more work, and so I've added a few more things. Great. So what do I want to say? In terms of child well-being internationally, not just in Europe, inequalities are large, and they're likely to get wider. I think that's primarily because policies are unequal and sometimes missing. Obviously, when you're outside of Europe, more of the policies are missing. In fact, sometimes entire systems are missing of social protection or child protection, and these drive unequal outcomes. I don't think there's a good argument for any country not paying for a full portfolio of family and child policies, but I do think that evidence drives the rationale for doing that, which is partly a reason I'm so keen that we have an accelerated birth cohort study in Europe. I want to talk a little bit about the type of data we have available to us now and run the rule over the quality of some of that data. I think over recent years, certainly in the past decade, the number of child well-being comparisons in Europe and globally has grown. There's what's it called? There's indices related to child development and social development all over the place, sometimes looking at inequality, sometimes looking at levels, often at the country level, juxtaposing indicators of children of different ages. It's a crowded field, but the data's not been there to help us really understand what's happening in terms of child development by age, or indeed whether a set of child well-being indicators for children under 6 would look different for children aged 6 to 11, or indeed children in adolescence. On my last count, which I admit it was in 2019, there were only 26 birth cohort studies globally that I could find, and just 10 in low and middle income countries. And they're necessary to help us understand the interplay of child well-being outcomes, as well as answer questions about what should we do first when trying to promote optimal child well-being. There's good discussions about transforming, reimagining education. That's where most of the money goes when a country spends on children. If you're in Europe, it's about 60%. If you're in Africa, it's about 90%. Education carries a lot of the burden, needs to do a good job. There's been transforming education discussions, but we're still collecting information on literacy and numeracy and standardized tests, and you'll see what comes out from UNESCO later. I'll talk a bit about that. Still focused on foundational literacy and numeracy. And we need to integrate policies. Life is complex, development is complex. Governments know that policy portfolios need to be coherent and complementary, and sometimes the efforts of Sector A accrue in Sector B. And unless we compile our collections of child well-being under particular surveys, which also have time elements, it's going to be very difficult. And I've tried this twice to put the evidence base together and talk about the evidence of cross-sectoral and intersectoral approaches to policymaking. So I think I've said some of this. Evidence drives decisions. Data needs child inequality, well-being inequalities are linked. We need better data to change the discourse. I don't think the human capital discourse, as long as it's been going on, is serving us very well. I think it's the reason some of the child policy portfolios I'll show you in a minute look like the way they look. And there's a need to understand child well-being interconnectedness over time. So there's a need for more longitudinal data. It doesn't mean we don't, for those of you in the room who think that I'm certainly not saying that we don't need evaluations or experiments, we don't need monitoring data, but when it comes to types of data we collect, it's horses for courses, which is an English phrase meaning you pick your data for your purpose. I wrote OECD's first child wellbeing index, and the first one that was presented to the European Commission, and the first one that UNICEF also did with colleagues, of course. I'm not so prolific. But there was a lot of compromises on the data front. We were juxtaposing sources and concepts without clear consideration of age in those pictures. And I think I can show you some of this now. Oh, quickly about inequalities. I assume the room is full of excellent professionals that really don't need me to tell you about inequalities in child well-being within Europe or globally. But I will nonetheless, just very quickly. If you look at the right-hand side of this is pre-COVID data on child poverty in Europe, because it ranges from, that's relative income child poverty, the threshold's at 60% of the median income in the entire population. That's a proportion of children living under 60% of that threshold, the median income. And it ranged from a low in Denmark at 1 in 10 children, to nearly 1 in 3 children in Romania. Child poverty is intrinsically linked to all of the other well-being factors that we'd like to discuss, particularly early years home environments, where parents are detached from the labour market, and safe, stimulating environments are important for child development from innate human skills onwards. I'm doing some work for LACRO, the Latin American Caribbean region. Right now, I just pulled this out as fertility rates. Their average rates are well above global rates. So even there's massive differences, and the progress on indicators are different in different regions of the world. I'm also doing some work with MENA. This is looking at, that's Middle East and North Africa. This is just looking at antenatal care visits. You can see that just 1 in 5 children in Djibouti get access to antenatal care visits. And well, all of the kids in Bahrain are getting it, but across countries, differences by urban, rural, high to low income matters. And I think if you were to dig down subnationally in any one of the indicators we look at, you'll find sort of, what do we say, country variable distributions, for want of a better term, and therefore it sort of underlines the necessity to be collecting micro level data. So we want data that is micro level, that covers a lot of child wellbeing outcomes, that accounts for age development. That's another reason I think longitudinal birth cohort study in Europe is a good idea.